Okay, which of the following is the most appropriate management at this time? And just kind of gives different kind of treatment options. So a 28-week-old premature infant is admitted to the neonatal intensive care unit, NICU, after an eventful C-section. On day 28 of life, the infant is noted to have poor weight gain and feeding difficulties. Eye examination shows bilateral tortuous and dilated blood vessels and a demarcation line between the vascular and avascular retina. The infant's mother is concerned about her baby's vision and asks about potential interventions. Which of the following is the most appropriate management at this time? Okay. So I feel like I haven't seen anything too much about vision, but let me break it down. So 28-week-old infant. So she just went through a C-section. Poor weight gain, feeding difficulties. So she has these bilateral tortuous dilated blood vessels on eye examination.
So if you were to guess a diagnosis, what would you what would you
Yeah,
say?
I'm not too sure about kind of, I don't think I've seen anything like this with the blood vessels, but the only thing that I know that is like close to that's in the category of um like delivery and baby eye things, or you give like with chlamydia, you give erythromycin, but
Okay.
I don't know if that has to do with
So
this.
how about so let's talk about risk factors. What kind of risk factors does baby have?
Um, Poor weight gain,
Okay, how
feeding
about even before that? Remember, the first sentence, I want you to pay attention very closely to because that's like kind of your chief complaint, right?
premature.
Yeah, premature. So now you have to ask yourself, right? Instantly, when I see premature infant, right, I'm thinking, okay, what are diseases that go with an infant that's premature?
Um,
So, eye disease, right? That of prematurity, if you remember.
oh yes, I do remember.
So that's one thing, right? Another thing is, I'm just kind of adding it on. I mean, there's a lot, right? But prematurity lungs, right? Lungs, you're missing some surfactant, right?
Mhm.
So all these things, right? You can have, necrotizing enterocolitis, right? Increased risk with prematurity. There's a lot, right? I can't remember. Maybe jaundice might be on there too, right? So all these things can happen to kiddos with prematurity. Okay, so in my mind, right, I could be wrong, right? But like I said, in my mind, I'm thinking, okay, so the risk factors, premature infant, likely, right? I mean, I'm not an ophthalmologist, right? I'm thinking in my head, maybe it's eye disease of prematurity. Okay, now I have a diagnosis that I can kind of get my, I can kind of back, right? Because of the risk factor. So now what do you want to do if it is, right? Because we could be wrong. We could be wrong that it's not eye disease of prematurity, but let's say it is. Now you can say, okay, now what do I want to do for this?
Um, so with the last answer choice, vitrectomy, I don't think you would remove anything, so I would
Okay.
probably rule that out. Um, so if it's this eye disease that's caused by the baby being premature, I mean, part of me is leaning towards just watching it and
Okay.
see if maybe they kind of not grow out of it, but I guess grow out of it.
Okay.
Um, Bevacizumab, I remember that like had from step one, it had like VEGF, which I know helps blood vessels kind of proliferate, but I
Okay.
don't know why you would use that here.
Okay.
Laser photocoagulation therapy, maybe.
Okay.
I'm not too sure.
Okay, so gut says A. You want to keep it or change it?
Um, could I phone a friend for what photocoagulation therapy is for?
Yeah, so if you're asking me, right, I
Yes.
would say all these seem very aggressive. okay, for a 28-week-old premature infant. Based on my kind of a clinical experience, which is kind of a semi cheat code, right? Because I see the OR board a lot, and I have never seen a premature infant undergo any procedure in the eye. So I highly doubt that it's some kind of procedure based thing. Could be wrong. Like I said, I could be wrong. But maybe 60-70% sure here. But yeah, I feel as though injecting VEGF into the eyeball doesn't sound, that sounds pretty aggressive. Laser FOAG therapy for premature sounds pretty aggressive. Cryotherapy, I'm not sure exactly what you're freezing, and then taking out that doesn't seem very safe either. So I would assume that if it is prematurity, eye disease, and as the baby matures, it should get better. And then as baby gets older, then you can make a decision whether to do something aggressive. That's in my mind. But like I said, I don't know too much about eye exams, so that's my clinical judgment here. Okay, let's see kind of what we went wrong here. So infants, poor weight gain, eye torches dilated between vascular viscera or retinal prematurity. So we're correct about the diagnosis. Condition that affects premature infants can lead to vision loss if not treated. Laser FOAG therapy is a standard. Okay, so reduces the production of VEGF, which conduces to abnormal growth. So, okay, so makes sense. Let's see. Important for monitoring progression of RP, but are not sufficient as sole management strategy for an infant with described findings. Intervention is needed for prevention of vision loss. So, seems like this is going to be kind of our standard. Intravish has been used as an alternative, but it's not first line, and its long-term safety and efficacy is being studied. Cryotherapy was previously used, but is largely replaced by laser FOAG, and then surgical, which removing the vitreous gel of the eye, reserved for advanced cases of ROP with retinal detachment and not indicated as initial case. So cool. I have never seen this, so I'm not sure exactly. Let's look this up. Let's look at this up here. Laser photo coag. Did I spell it right? Laser photocoagulation therapy.
Yeah.
What is laser photocoagulation therapy for? Involves using a laser to create small burns on the edges of abnormal retina. This treatment helps stop growth of abnormal blood vessels. The retina reduces the risk of vision loss or blindness in premature infants with ROP. Okay, cool. Learn
Okay.
something new every day. But does that make sense? Kind of how I'm thinking, and kind of I think we're on the right path, right? I would say that just I want you to commit to kind of a diagnosis is going to be kind of the next step for you, I think.